Hi, and welcome to our Caring for the Caregiver seminar. My name is Krista Mostowski, and I'm with Community Hospice. We'd like to start by thanking our partners today, Sutter Health, for putting on this presentation. Our topic today is infection control and prevention, how to appropriately wash your hands. And our presenter today will be Ms. Karen G. Jesse, the clinical educator for Community Hospice. Karen, I'll go ahead and let you introduce yourself. But before we get started, just a few housekeeping rules. If for at any time you have a question, I invite you to please enter that question into the chat box, and we will make sure to address your questions throughout the presentation. This format is also set up as a meeting format, therefore you can see all of the participants. We are recording this seminar today, and we will be sharing it on our social media as well as websites and our YouTube channel for more to view after the presentation. So if you do not want your photo to be part of that recording, I ask you to please leave your camera setting off, but you are invited to show your face through the presentation if you'd like as well. So at this time, Karen, I'll let you go ahead and get started.
All right, thank you, Kristen, so much. Good morning, everybody, and thank you so much for joining us. In this pandemic, everything is about infection control and how we can stay healthy and prevent infections as much as possible. And the best way to do that, the starting is definitely to keep clean hands. And so washing your hands is really important. And we'll walk through the steps of what can cause infections, how we wash hands, how we can sanitize our hands, and just some tricks of the trade, day-to-day things that we can do to keep ourselves and our families as healthy as possible. So to get started, some of the objectives are to understand the different types of infections. There are such things that are healthcare associated, and that really means that you could get an infection from a hospital or a skilled nursing facility or a clinic versus a community acquired, which really talks about our surroundings, our homes, our town, our just outside of any kind of healthcare facility. Within our community. Learning the role of hand hygiene plays a huge role in healthcare associated infection prevention and of course community acquired infections. So we are going to learn the right time and the right way to wash our hands.
Hey, Karen, I'm going to stop you because we actually don't see the slides changing. And it's okay. Just go ahead and move your cursor over to where yep, and then there you are. Thank you.
Sorry.
That's okay.
Thank you. Okay, here we go. So how do we stop the any kind of infection spreading? Well, first we need to understand that there are germs and they are a part of our everyday life. And of course, they're found in the air. There can be germs in the soil, in water that's not been sanitized. And of course, we have germs in our body and we have germs outside of our body. Some of these germs are helpful and others are harmful. Many germs live in our bodies again, and some without, and some are really here to help us, and some can cause us to be quite sick. Make sure I'm on the right screen here. So we really need to understand how infections can occur. And an infection occurs when germs of any type enter our body, and it's foreign to us, and so it increases the number of reactions that our body can have. There are usually three types of, three things that are necessary for an infectious process to occur. One is we need to have a germ, and the source can be found either in sinks or surfaces or human skin. Bathrooms are really good for it. Our cell phones, keys, because we don't think to sanitize them very often. Those types of things can carry germs. Then we need a susceptible person with a way for the germs to enter our body. A normal, healthy person typically does not get sick from everyday germs. However, someone with a lowered immune system, someone that is either older or younger or has a disease process going on with them that would make them more susceptible to having a reaction to those germs, would be susceptible to that. And then the transmission, and that is the way for the germs to be moved into that person. That can be through not washing your hands. It could be on your food. It could be on the plate that it was served on. It could be that we rub our hands on our faces, we shake hands, and we, don't think to wash our hands or sanitize our hands, although during this pandemic, I'm sure that that has changed quite considerably. Washing your hands keep us healthy and prevent the spread of respiratory and diarrheal infections going from one person to the next. Germs can spread from other surfaces like touching your eyes, nose, mouth, and we talked about that a little bit, when preparing or eating food and drinks with unwashed hands. If we're touching contaminated surfaces or objects, again, the same process applies. So there are some things that we can do, and we can practice routine cleaning of frequently touched surfaces, tables, doorknobs, light switches, banisters on our stairs if we have stairs, countertops, handles, our desks, especially at home too, also where we don't have routine cleaners that come in. A lot of us work from home, and so making sure that area is clean, our mouse, our keyboard, toilets, of course, faucets, and sinks, and any other household thing that we happen to use and touch frequently. There are a lot of different cleaners that are out that help us to disinfect. But again, in this pandemic, it has been difficult to get a hold of these things, right? So we are able to make our own solutions using bleach, which is readily available almost every store I've gone to. And the way to make this solution is to take 5 tablespoons or 1/3 of a cup of bleach into 1 gallon of room temperature water, or you can do 4 teaspoons of bleach per quart of room temperature water. And this makes a nice little bleach disinfectant that you can use in a spray. Or if you are going to use this or mix it in a large container, please remember to use gloves, and then you would have a wonderful cleaner that you can use on a daily basis. There are, of course, alcohol solutions that you can use as well. At least 70% alcohol needs to be part of that product. So just to clarify a little bit, what is a healthcare associated infection? A healthcare associated infection is an infection that occurs in a patient during the process of care in a hospital or other healthcare facility setting, which has not been presented or incubated at the time of admission. So you were not feeling sick when you walked into these places, but you get sick in addition to whatever else was going on while you're staying there. And these infections include this includes infections acquired in the healthcare facility setting, but appear after discharge. So sometimes you're fine all the way through your stay, and you could get sick once you go home. Other things are more serious illnesses, prolonged stay in a healthcare facility or a healthcare service, home health, palliative care, hospice, sometimes long-term care facilities for if you have a disability, excess deaths, any place that has any type of death events, high additional financial burdens. This also increases high personal costs on patients and their families. Community-acquired infections, on the other hand, a community-acquired infection is an infection caught by any person from the community around them, such as a respiratory infection, that includes both viral and bacterial, stomach flu, strep throat, sinus infections, mono, and of course COVID-19. Hand transmission. So hands are the most common vehicle to transmit healthcare associated pathogens or germs. Transition of healthcare associated pathogens from one person to another through healthcare workers' hands requires 5 sequential steps. So in sequence, we have to have these 5 steps. One is that germs are present on the skin or in their immediate environment and surfaces. 2 is that the germ is transferred onto that person's hands. 3, germs survive on the hands for several minutes and proper hand washing techniques were not used, which result in continued contamination. And 5, contaminated hands transmit germs through direct contact with others and the environment. So it doesn't have to be that my hands were contaminated or have those germs lasting on them. And I've touched another person's hands. It could be that I used a door handle that someone else then goes behind me and touches, and then their hands also become contaminated. Hand washing should be part of everyone's daily routine, and especially before eating or handling food. Definitely after using the toilet. Those signs that say it's the law for every restaurant worker or healthcare worker to wash their hands before they leave. It's a rule that everybody should follow. After blowing your nose or coughing or sneezing, especially if you've used your hands to sneeze or cough into, after touching animals or animal waste, after handling garbage, after changing a diaper, and before and after touching a sick or injured person. So there's 2 different ways that we can decontaminate our hands from these germs. One could be a hand rub, and then the other way could be to use soap and water and wash your hands. The primary purpose of hand soap is to remove germs and bacteria. It does not kill the germs or bacteria, but it captures them. And when washing your hands with soap, and the dirt and germs trapped in the natural oils of your skin will be lifted and suspended in the water and get rinsed away. Alcohol-based hand sanitizers, on the other hand, is proven to kill germs and the bacteria, but your hands may remain soiled. The alcohol kills the bacteria by softening the bacteria membrane, allowing the alcohol to render the bacteria to be ineffective, or basically just you can't transmit those germs to anybody. So there's 5 steps to hand washing. 1, wet your hands with clean running water. You apply soap liberally and lather your hands, rubbing them together with the soap. Then you want to lather the back of your hands between your fingers and under your fingernails, and this is usually a good way to do that. Scrub your hands for at least 20 seconds. If you don't have a timer, you can sing happy birthday from beginning to end twice, and that equals your 20 seconds. Rinse your hands under that clean running water, so you never actually turn the faucet off. You dry your hands with a clean towel or let them air dry if you're in an area where there is no clean towel for you to use. You can use your elbow or at the back of your wrist to turn that faucet off if you don't have another way to turn the faucet off without using your hands. Here's a nice little poster for you guys, just kind of showing you the good technique for washing your hands. Don't see any questions. I'm happy to take questions if you guys have any. Okay, moving on. Hygiene during COVID-19. During this pandemic, you should also clean your hands after you've been in public places and touched an item or surface that may be frequently touched by other people, door handles, tables, gas pumps, shopping carts, electronic cash registers or screens, and before touching your eyes, nose, or mouth. Okay, so what if you don't have soap and water available? There are hand sanitizers, and you want to make sure they have at least 60% alcohol in them. And you just rub them really well, vigorously together at front and the back of your hands, in between your fingers and your nails until your hands are dry. Sanitizers can quickly reduce the number of germs on your hands. However, sanitizers do not get rid of all types of germs. Hand sanitizers may not be as effective when hands are visibly dirty or greasy, and hand sanitizers may not remove harmful chemicals from hands like pesticides or heavy metals. It is a good way to cleanse your hands of germs or make them clean when you're going to be touching other surfaces until you are in a place where you have running water and soap that you can wash your hands with.
Hey, Karen.
Yes, ma'am?
So we have a question, and it said they're sorry they stepped away for a moment, and you may have already answered this, but how long do germs stay on everyday objects like keys and counters and things like that? Should we be washing those every day, every few days, every week? What would be your recommendation?
I would recommend at least daily cleansing of those keys and countertops, definitely several times a day if you have to. Usually after breakfast, after you've eaten, it's a good idea to wipe everything down. But twice a day for your home is sufficient. You don't have to be so diligent that every time you walk past something you clean it, but you clean your keys and your cell phones at least at the end of the day. Okay?
Thank you, Karen. Thank you.
You're welcome. I think we kind of talked about the use of hand sanitizer, but I'll go over it one more time. So you're applying the gel product to the palm of your hand. Of course, you want to always make sure that you read the label to know how much. Some will say a pea size, some will say a quarter size, some will just say one dollop. So you just want to make sure that you follow the recommendations on the back of that label. You're going to rub your hands together. Rub the gel all over the surfaces of your hands and fingers until your hands are dry. And this should take around 20 seconds. So 20 seconds is the key number here. There's just a slight caution. We want to make sure that you're aware that swallowing alcohol-based hand sanitizers can cause alcohol poisoning. So you want to be very, very careful. If you have wet hands and you've touched your mouth, you want to be able to rinse it, and you want to keep it out of the reach of young children and supervise the use when you are, excuse me, having them sanitize your hands with a alcohol-based hand sanitizer. And this is just a really good demonstration of how you would wash your hands or sanitize your hands with a hand rub. The next slide is going to show you really what hands look like full of germs. So the very first picture where it looks very bright is before our hands are washed, and that's how many germs are there. And then all we did was take that hand and rinse and shake the water off. So this is running your hands underneath a faucet and shaking, and you can see that how much of those germs are still present. Then the next slide is 6 seconds with no soap. So just a quick rub under the faucet, rubbing your hands, not using soap.
Sorry,
The next slide. Sorry,
sorry to interrupt again. We can't see the slide.
I can't.
It's okay. I think if you move your cursor, there you are. Thank you so
Sorry.
much.
Thank you. So slide 4 here is 6 seconds with soap. And then the slide 5 is 15 seconds with soap, and then slide 6 is 60 seconds with soap. And you can see how many of those germs come off, but there's still little areas, nooks and crannies that you can see that still have a little bit of germs on there. So it's important to frequently, but not, what's the word I want to use, not religiously wash your hands, but frequently sanitize and clean your hands. Don't want to be in a place where we're doing it obsessively. In summary, we want to make sure that you know that each year millions of people are affected by infections transmitted in both healthcare and non-healthcare settings. Infections can lead to more serious illnesses, and prolonged stay in healthcare can cause disabilities, increased resistance to antibiotics. The more susceptible you are to a particular type of disease or germ, and more frequently you're taking those antibiotics, your body will start to resist that. Can cause deaths and financial burdens to the healthcare providers. patients and their families, and the most effective intervention to reduce transmissions of these infections and resistant germs is good hand hygiene. It saves lives to wash your hands, and if you don't take any action today, there is no cure for some of these things moving forward. Any other questions, thoughts, or concerns?
There is a comment. One person said, after that hand slide, I think I'll be washing excessively.
But remember, some of those oils in your hands help to protect your skin. If you wash your hands too obsessively, you're going to cause cracks in your skin, and it's going to become very dry, and that's going to make you susceptible to those germs. So everything in moderation, but we want to do it thoroughly.
Thank you.
You're welcome. Well, we have come to the end of our presentation. Here, oh, it's not working again. Here are some of the resources we have that you can certainly go out online and get more information from. And they have wonderful amounts of education on these sites. So by all means, please reach out and go and look for those yourselves.
Perfect.
Thanks.
Thank you, Karen. At this time, we'd like to ask our participants if they have any questions. You can feel free to enter them in the chat box, or please feel free to unmute yourself as well. And Karen will address those questions for you. We'll just give you guys a couple of moments. I think I'm with our participant. You know, with COVID, it definitely we are most definitely washing our hands way more than we used to, which is kind of a weird thing, right? Because we always washed our hands, but I think we just now are, you know, more alert or aware of what's going on, and have taken that to a different level, which is a good thing. Rita, I see you've joined us. Thank you. Do you have some questions for Miss Karen?
I do. How do we, you know, I'm the one that said, I'm going to go wash my hands right now because that slide really scared me. But but I'm thinking of, you know, just our everyday things that we touch, like my keyboard, my keys, my phone, etc. How do we know, or how should we act, and what should we do when we go to grocery stores, when we go to outside, when we don't know when or if they have disinfected that surface?
So in your home, you know when you've washed your hands and when you've touched something, when you're eating and you've touched your keyboard or anything like that. If you're eating and typing, you want to make sure that you wipe down your keyboard. Turn it off first, otherwise you will lose things on the computer. Ask the person who's done that several times now. But wipe your surfaces down. Go and wash your hands or sanitize them. Unless they're soiled, then you want to make sure that you wash them. When I'm out in public, I'm always sure to wear a mask, right? So I keep myself safe and I keep people around me safe. When I'm going to use a cart, I take my own little personal stack of wipes with me. Most stores, I've noticed, have their own wipes inside of the store. So I don't take the cart from outside. I use the cart that's already inside the store, close to where they keep their wipes. And I take one of those wipes and wipe down the cart before I use it. Keys, first thing in the morning, last thing at night, I sanitize both, because when I cleaned my keys for the first time, Rita, they were so dirty. They were so dirty. I was embarrassed. It was not pretty, but they're shiny all the time now.
We do have an additional question, and I think I have a question that tags on to Rita's as well, but we'll take our participant Miriam here. She says, is it safe to use bleach to clean any surface?
For the most part, yes. If you are using a liquid version of it, please be very careful around your electronics. You want to make sure that you don't get a lot of fluid into that area. It is much safer to spray a little bit of bleach solution, as we talked about, not bleach directly from 100% concentrate, onto a paper towel or a towel, and then use that just dampened but not soaking wet. Okay. You want to make sure, if you're using a bleach solution, that you let your area dry very well before you put any food or anything else on it. Okay.
What about other sanitizers like Lysol or, there's lots of different spray other than bleach. Do
Right.
you think those are beneficial to use on electronics or rooms, or what would be your thought?
Again, around your electronics, be very careful. Make sure those things are not soaking wet. We do use Lysol wipes because they say on the container that it works effectively against 99.9% of germs and viruses, and including coronaviruses as well. So always look at what your product is promising you. Look at your labels, make sure that it's going to be effective for what you want it to be effective towards, and then certainly use those. Lysol sprays are always good if there are difficult areas for you not to be able to clean or wipe down. A spray is always good, but you want to make sure it's at least 6 to 10 inches away from the surface, so that it doesn't again saturate or get into areas that are going to cause damage to some of this really expensive equipment that you have, and then you're going to spend more money trying to replace.
Wonderful, thank you.
Mhm.
Are there any other questions at this time? Okay, so if there are no additional questions, then I would like to just invite you to join us for our next Caring for the Caregiver event. It will be on March the 11th at 11 o'clock, and the topic will be finding alternative help. Again, we'd like to thank our partners at Sutter Health for helping put on this webinar, providing resources to the community. It's just a great thing to do, especially during this time. So thank you to Sutter Health for partnering with us. And Karen, thank you so much for joining us today and providing all the insight. We really appreciate it.
My pleasure.
All
Thank you.
right, with that, we hope you stay well and safe, and we look forward to seeing you all next month.
Thank you.
Bye-bye.